From the plains to the rolling hills, Oklahoma is a state that resonates with stories of resilience, determination, and pride. Welcome to Inside the 1581, a podcast of the Oklahoma Hospital Association. Together, we'll dive deep into the heartbeat of the great state of Oklahoma as we journey through the rich history, diverse culture, and the ever-evolving landscape within the 1,581 miles of border in our nation's 20th largest state. Each episode of Inside the 1581 will feature conversations with the many voices which help shape our state's future and our shared vision of improving health and healthcare in Oklahoma.
Thank you for joining us in this special edition of Inside the 1581. We're here at the Convention Center in Oklahoma City for the annual OHA Connect conference. So we've got about 500 healthcare leaders from all across the state. Yesterday we opened, or I guess on Tuesday, we opened with 280 maternal and child health leaders as part of the Oklahoma Perinatal Quality Improvement Collaborative pre-conference. So all of this is kind of rolling in together. And so we thought, as we did last year, that we would have some voices from across the state. And I am delighted today to be joined by Corey Lively, who is just installed, right, is the new vice chair of the OHA. And Corey is the CEO in Elk City. And Corey, tell us a little bit about yourself, your organization, and certainly how you got into the field of healthcare.
Perfect. Thank you, Rich. And I really appreciate that. It's always a pleasure to be at Connect and be with your peers and see all the new faces and the familiar faces and learn about all the things that's happening. And so really appreciate the opportunity to be here today. And thanks for letting me share about our organization. So we are a very unique organization. Great Plains Regional Medical Center in Elk City is a 62-bed acute care independent rural hospital. We're actually widely regarded as one of the most independent hospitals in the nation.
As is all of Oklahoma, pretty darn independent.
That's right.
Yeah.
That's right. We're unique in that back in 1927, Dr. Michael Shadid, along with the Farmers Union Cooperative Hospital Association, started our hospital, and they sold shares in the Farmers Co-op. And they sold about 500 shares for $50 a year. And if you held a share, you got free health care at our brand new hospital. And we still operate under that very similar model today. Shareholders elect the board of directors select the CEO, and we do not have any connection to a public trust, a city, or a county, or anything like that. So we are truly independent.
So you're like my electric co-op almost.
Absolutely.
Absolutely. That is a pretty, having served in many states, that is one of the most unique governance structures, I think.
Absolutely. I tell that story when I get the chance, and people are saying, wait, I don't understand. Do the shareholders own the hospital? Well, technically, yes, they do. And they still have the voting rights and things like that. There's no monetary value, but it's really unique environment.
Well, you need to get that guy on the farmers commercial doing your ads for you. That'd be the way to do it. We are farmers. Yeah. Well, Corey, I know, like myself, you've been in several states, and, tell us a little bit about your experiences, and then how do you compare that here in Oklahoma?
Sure. I think Oklahoma's hospital marketplace is very unique. It blends the challenges of rural healthcare delivery along with dynamic integrated systems. And having worked in multiple states, you see that model. But I think Oklahoma is unique in that we have such a heavy reliance on healthcare delivery in our independent rural markets. We are definitely one of the most dynamic and certainly one of the most resilient states and to deliver healthcare. It's really pretty cool. I think given the strong mix of independent and rural and system facilities, we all operate in a reimbursement environment that seems more restrictive than other states that I've been in. And so that also gives us this other unique challenge from that perspective. But again, working together, finding creative solutions, focusing with our advocacy on the issues that come our way, developing service lines in our rural areas that are appropriate for our hospitals, and deliver care that keeps people at home and only sends them to our metropolitan and our system when it's right for them, when it's right for the community. I think that's what makes us unique. It keeps us very patient-centered in the rural areas. And then the last thing I see real opportunity in regionalization of services, different alignment with physicians in our community than we've had in the past to be successful, and then continued advocacy around reimbursement, educating our legislators. It's so critical to the success, not only of our rural hospitals, but the integrated systems as well.
So in your organization, for our listeners who might not be familiar with kind of the different types of hospitals, we have our rural emergency hospitals, which are a new creature of Congress. They typically don't have inpatient overnight stays, and they are a hospital that provides a level of acuity without the requirements overnight. Then we have our critical access hospitals, who are probably our most vulnerable, also a creature of Congress. And then lastly, we have our prospective payment hospitals. And for our listeners, that's just how they're reimbursed. They're reimbursed based on a diagnosis for your care. And so you represent a rural PPS hospital. And so for listeners, give them an appreciation of the fact that although you may be rural, you offer all of the services that we would typically find in a more urban setting, with maybe an exception of open heart surgery or neurosurgery. Tell a little bit about that.
Sure. And I think we are very unique in that we are situated halfway between Oklahoma City and Amarillo, kind of on the western frontier of Oklahoma, right up.
It would be Amarillo?
That's right.
Yeah, Amarillo. Okay.
Yeah. And so we are a traditional hospital. When you tell someone, "Hey, I work at a hospital," they have this picture in their mind. And so, to your point, we have primary care and specialty service lines that really no one else has in Western Oklahoma, from orthopedics to ear, nose, and throat specialty, urology, neurology, pain management, general surgery, and all those things. So we are very fortunate in our position to be a regional kind of hub and spoke hospital where we deliver traditional outpatient and inpatient care like someone thinks about historically when they think about hospital and healthcare delivery.
And you, as an organization, are connected to, albeit loosely, to other similarly situated hospitals. And you guys have formed a network. Tell us a little bit about that network, and certainly how your residents benefit from that.
Absolutely. So we're a part of a member network called Life Care Health Services of Oklahoma. And that is a total of 9 member hospitals that are also predominantly rural, very similar in size and shape and healthcare delivery. And that's one of the things that I think is very important as we talk about regionalization of shared services and partnerships that can help us be successful long term as independent providers. And so we share best practices, we share patients, we share the passion and love for the healthcare delivery in our communities. And so when one of us succeed, all of us can succeed based on that set of circumstances. And it's this really cool environment. And I think it's very unique, not only in the state of Oklahoma, but really in the United States, the partnership that we have through that.
And you are allowed to stay independent, each individually. So you just mentioned a word. You said you share. And unfortunately, you're going to share the same level of pain that our providers all across the state are going to be shared with. And that is the fact that Congress enacted significant Medicaid cuts that will reduce direct payments to hospitals over the course of the next 10 years by $6.7 billion. And I know you've heard me say this, for our listeners, you put that in perspective, that amount is almost equal to the total Department of Defense expenditures in our state. Let that sink in. So we look at what we've got in Tinker and we've got in Fort Sill or Vance, all of the spending the federal government is making on defense in our state, the cuts to hospitals are going to be equal to that. And if you spend that out over the course of the 10 years, you look at how that dollar is respent and respent again in the community, it's about $20 billion of economic vitality that we are removing from our state. So we have a tax cut nationally that's going to remove $20 billion of healthcare spend in our state. And so I say that in the sense that our hospitals are going to have to respond to this significant reduction of resources. How are you guys approaching this? And certainly I know whether it's at the OHA board, it's your life care board, or any other regional meetings that you go to, I know I hear it's the topic du jour, right? How in the heck are we going to do this? How are you guys approaching it?
Absolutely. That's a great question and set of comments. We talked about yesterday, there's 6.7 billion reasons now to work together. There's 6.7 billion reasons to be involved in your hospital association, to be involved not only in your community, but with organizations like OHA, like Life Care. And so I think for our organization, at Great Plains, we're potentially facing a $5 million per year cut in reimbursement. It's already very difficult to provide the services that we
So
provide.
5 million, so that's $50 million over the course of the decade. So your delta is going to be from what you're getting paid to what you're going to get paid. Do you know any other industry other than perhaps the collapse of energy back in the 90s that has gone through this level in your community, this level of reduction?
I do not. It's such an extraordinary circumstance and series of events that can be catastrophic. And when we talk about how we deliver healthcare today, whether it's our emergency room, OBGYN services, delivering babies, surgical services, there's going to be some really hard decisions coming forward to us if things perpetuate in the way they've been presented now. We're not going to be able to present all of those services to our community. And so it's going to be reduced access. And we must, as I mentioned a couple of times, we must begin to regionalize and share and work together to prevent some of those service line losses.
And so for you, I mean, let's just talk about OB as an example. I mean, you're the provider of OB in true Western Oklahoma. Yes, we do have a delivery at Weatherford, and we do have it in Woodward. But literally, when we take, Elk City south, I mean, you're it. So those babies are coming to you. So the question for you and your trustees and trying to decide, can we sustain this with $50 billion of reductions? I'm sure that's a gut-wrenching conversation you have at your board meetings.
It really is. The thing to get in our mind, especially with our board and our community, our hospital, the physicians that provide this service, this is not an abstract policy issue. This is a direct threat to our existence, our livelihood, and the service that we provide.
And the health of all of Western Oklahoma.
The health of all of Western Oklahoma. We're very fortunate that we have 4 physicians 24/7, 365 that provide this level of service. And we just this year brought on an additional obstetrical physician who is doing fantastic in our community and growing and building his practice. And then to be faced with the reduction that we're facing, it's an extraordinary life event. So we have to be proactive to make these decisions. And I think for our community, for our hospital, this is a commitment that we're going to make. We're going to do everything we can do to maintain this service despite the cuts that are coming, because we know we're kind of that last bastion of hope.
Right. And, and you put all your effort into retaining that service. It also kind of, begs the question, there may be some that you can't do anymore.
That's
because the resources are gone. And Corey, when I look at what we've been able to do since the legislature and the governor supported our reimagining of Medicaid, and so doing that, it really allowed the state to leverage the resources it has, which is through a fee on hospitals. So I think for our listeners to really understand that the hospitals pay for Medicaid expansion.
Absolutely.
And the hospitals pay the state share that allow us to enhance our reimbursement so we're not being paid below cost. And we have an opportunity to really make an investment in our future. And I think we heard about that here when we're here, and it goes back to the OB, where the March of Dimes just announced that Oklahoma is now ranked 12th nationally in maternal morbidity, which means our outcomes for moms after delivery and in getting moms to the place of delivery, we rank 12th nationally. And we know, hasn't been announced, but we know that the new data that comes out, which will be announced next year, is going to show us at 10th. I mean, this is our first top 10 performance and quality indicator for our state, and we should celebrate it. And on the heels of all of this is a Medicaid cut that could then send us backwards again.
Absolutely. And in the unique position that the Oklahoma Hospital Association has put us in with the new relationship with the Oklahoma Perinatal Quality Initiative and those partnerships. We at Great Plains have a new partnership with a tele-NICU service. And so it really, to your point, improves the maternal health and outcomes of the moms and the babies and gives us access previously that we just did not have access and education to. And I think focusing on those types of things keeps our community and our region safe with the safe healthcare delivery. And it's such a scary thing that to know that potentially the directed payments will be cut. And the service lines that we have to examine is just such a scary environment right now.
Well, and what we did, if we use that March of Dimes study, what was illuminating to us is that what the part that our hospitals can control, I mean, we're excelling. I think the second chapter of this is, how will our state respond with their state response? Because what we do know is we do a poor job of supporting moms and babies and young children after the fact. So I think that is something that as an association, we're going to spend some time on helping the legislature to understand that they truly have an opportunity to be top 10 like the hospitals have done in preparing moms and babies for delivery. Now they've been delivered. They're growing up in this great state. They have an obligation to make sure that they have the best opportunity. And ultimately that feeds into our schools later on.
Absolutely. One of the things that I think we do well as an organization and collectively with OHA is we are incredible advocates with our legislators and helping them understand, because healthcare delivery, hospitals are so complicated, the reimbursement process, the delivery, and all things associated with that. And so one of the things that I think we do well and can continue to do well in the future is to keep our legislators informed and in our corner. Grassroots advocacy has always been our strong point in Oklahoma.
And I agree. And it is that, Connect is an opportunity for us to come and celebrate that. I know that you're the chair-elect of OHA. And as you look forward, you've been involved in the association for some time. You served on the regional policy board for the American Hospital Association. So you're kind of an association guy, and we appreciate that. And so as you look forward, what do you believe are the areas that as an organization we should focus on, either internally, but certainly externally, as we try to improve health and healthcare in our state?
Sure, I appreciate that. So there's really 5 things that I think are really important going forward. And that's strengthening rural healthcare sustainability, which we've touched on frequently during our conversation so far. The second thing is workforce development and retention. I know in the rural areas, we are often the ones that develop our own programs regionally with the universities to train nurses, to train scrub techs, rad techs, lab techs, all of the ancillary services. On top of that, we have great relationships with Workforce Training Commission to recruit physicians to rural areas. And so I think that continued focus on developing our workforce long-term, as we've heard throughout Connect, the workforce is aging out. There are many people quitting, silent quitting, and all those things. And so I think if we're not focused on that, we could be in real trouble in the future. The third thing is physician alignment and different types of service delivery models, focusing on increased telehealth, focusing on sharing physicians, whereby like our community can only support one gastroenterologist, right? So if we share with Altus, with Woodward, with Weatherford, regardless of the specialty, that's how we can be successful long-term. And we can partner with the large integrated systems in Oklahoma City, Tulsa, and some of the more metropolitan areas to help provide those services as well. I think that's critical. Fourth thing is access to behavioral health services. I had a conversation this morning. We held a 15-year-old girl in our emergency room for 15 days earlier this year. That's just unacceptable.
Absolutely.
That's unacceptable access to behavioral health.
And we have daughters, right?
Yeah.
So this is unconscionable.
I have a 15-year-old daughter, and so I can't imagine a world where that, might happen. And all of us need to be responsible for getting engaged and helping those folks who are in that space and the folks that works with our hospitals. It's such an important thing. And then the last thing that we've touched on is legislative advocacy and education, staying connected to those who make policy in our community, in our region, in our state. Having been part of regional policy board at the federal level, it's so important that we just stay hyper engaged to not only educate, but really celebrate our successes. And I think the March of Dimes data, we don't do a good job of that in hospitals sometimes, talking about the things that we've done well or that we do really well. We focus on the issues that are right in front of us sometimes. And I think if we stay focused on that and celebrate those wins, we have the unique opportunity in Oklahoma to really win over our state government.
I agree. There's certainly a lot of work to be done, and there is a lot to celebrate. And that's what we try to do at the Connect conference. And so you've been listening to part of the voices here of the Oklahoma Hospital Association at the 2025 Connect conference, where we're bringing together healthcare leaders and partners all across the state in our effort to improve health and healthcare in Oklahoma. So we're going to come back and we're going to hear another one of those voices. But first, we're going to hear from a message from our partners at PYA.
In today's healthcare environment, one size does not fit all. Resources are limited, but demands are not. PYA's Overwatch lets you choose the exact level of compliance support you need without paying for the services you don't. Your Overwatch is built for you. Learn more at pyapc.com.